It's normal for a baby to cry 2 to 3 hours per day for the first 6 weeks. During the first 3 months of life, the babies cry more than any other time. Often, taking care of the baby's needs is enough to soothe the baby, but sometimes the crying goes on longer. Now, what's the reason that babies cry so much? And how can we calm a crying baby? Hello and welcome back to our channel. This is Dr. Fatima and today we are going to talk about what to do when babies cry. So let's go! A group of researchers from Australia published a paper about the approach to a crying baby. And they mentioned that the first thing that you should check when a baby cries is the feeding. Is the feeding enough? Is the position of feeding okay? And can the baby suck properly? These are the questions that you should ask your healthcare provider and ask them to correct you if you are doing it wrong. Because persistent feeding difficulties is related to excessive crying in the infants. Also, the babies with persistent feeding problems are more likely to have feeding problems in their later childhood. And it's been proved that successful breastfeeding protects your child against future feeding problems. This article also explains that the mothers who breastfeed and have moderate levels of physical contact with their children are more likely to have more settled children. On the other hand, high-volume breastfeeding with low-fat content may result in functional lactose overload in breastfed babies in the first weeks and months, causing low-grade intestinal inflammation and an irritable, hungry infant with tympanic abdomen and frequent explosive stools. So you have to make sure that you are not over or under feeding your infant. You should feed your baby on demand and it's mostly around 8 to 12 times per 24 hours. But sometimes you get confused and you're not sure if you're feeding your baby enough or not. And that is when you should call your healthcare provider and ask for their guidance. The next important factor that you should consider when your babies cry a lot is their sleep. Breastfeeding on demand and co-sleeping with your baby can decrease the crying in the first 3 months of life. Co-sleeping in the mandatory supine position facilitates the exchange of sensory data between mother and child and is the safest for babies in the first months of life. Young infants are also the safest co-sleeping in the same room as their parents during the day. On the other hand, breastfeeding is more likely to be successful if the mother and the baby co-sleep. And you should know that there is no evidence that the parents of breastfed babies get less night sleep compared to the ones that are fed with formula. Another important factor that you should consider while taking care of your baby is skin-to-skin contact. Sensory stimulation in the form of skin-to-skin contact from birth promotes self-regulation in the baby and helps optimal development of their brain architecture. Carrying the baby, on the other hand, is a rich source of sensory motor stimulation and physical contact from birth. Carrying the baby, even in modest amounts and the amounts that parents and families find appropriate for themselves, is associated with having a more settled baby. But sometimes it's not possible for you to carry your baby the whole time he's crying. So there are these comfort cushions that you can use time to time when it's really impossible for you to carry your baby. Some of these comfort cushions have been designed by moms for the times that you need an extra pair of hands to soothe your baby. They actually work quite well when your baby is suffering from the symptoms of colic or reflux. The comfort cushion cocoons your baby gently and securely on their tummy, and there is this vibration and the sound of a heartbeat that might give the baby the feeling of being back in the womb. I'll put the link of one of these comfort cushions in the description so you can check it out for yourself and see if it suits you. Organic disturbances glasses are another reason that your baby cries a lot, but it actually is not that common and happens in only 5% of the babies that don't have fever. So in this case, you should take your baby to a doctor and they would do the physical examinations and run some tests. The doctors mostly do a urine analysis because the urinary tract infection is the most commonly occurring physical problem in these type of babies. But the doctors might do other investigations if they suspect other problems. On the other hand, the diagnosis of gastroesophageal reflux disease among crying babies has increased dramatically during the past 2 decades. There are also some red flags in crying babies that you cannot calm them down. The first red flag is crying with abnormal or distressed breathing. If your baby is breathing faster than normal and his nostrils are flaring, well, these are the indications of breathing difficulties. Crying, in addition to not eating properly, is the second red flag. One of the things that you might notice when your child is unwell is that they refuse to eat. Babies can get dehydrated really quickly if they are not fed enough. So if they are refusing your breast and they don't eat well, that's a red flag. As an example, your child might only eat half of his feeding during 24 hours or might not even wake up to be fed. Another red flag is a crying baby with less wet nappies, or in medical term, less urine output. Low production of urine is concerning. So if the number of your child's nappies is less than half of its normal number, it is concerning and is considered as a red flag. Fever accompanied by a non-blanching rash is another risk factor. A non-blanching rash is a type of rash that doesn't disappear by pressing. These symptoms can be indicative of meningococcal infection. However, in most cases, you mostly see other red flags sooner than this type of rash appears. A temperature over 38 degrees in a baby less than 3 months is a red flag. In older children, we look at the child as a whole and not just a number. But in babies less than 3 months, a temperature of 38 degrees or higher is an automatic trip to the hospital. Unusual skin color and a change in the normal color of the skin is another red flag. In cases where the baby turns blue and it can be in his lips or nail beds, this is an emergency. Also, if the baby turns really pale compared to his usual color, it is another red flag. That was it for today. Thank you guys for watching, and please don't forget to like, share, and subscribe. And if you guys have a medical problem that you think that I can help you with, just leave a comment below and I'll try to get to it as soon as possible. Bye!